Now, the passing of the National Health Insurance Bill has been met with mixed reactions from health practitioners and unions. 205 members of Parliament voted in favor of the NHI Bill and 125 voted against it in the National Assembly on Tuesday. Let's get some reaction now from Dr. Katlego Mothudi, who is the Managing Director of the Board of Healthcare Funders. Dr. Mothudi, thank you for making time for us this afternoon. How do you understand this bill going to affect those who have medical aids?
Thank you, Clement, for having us. What the bill says about the role of medical aids in the future is that they will be limited to providing what is termed complementary cover. And what they explain is that this would be for those services that are not covered by the bill. But the interpretation of what that means still leaves us in murky waters because, one, the bill talks about comprehensive services. That is difficult to find. Secondly, we know that the bill is in pursuance of universal health coverage, which seeks to establish a continuum of care, which starts with promotive and preventative elements of care. There's in-hospital services and then also palliative or rehabilitative services. What that might mean is that schemes could be relegated to providing what is just discretionary elements of healthcare or those that are defined as aesthetic or cosmetic. But because the definitions are not quite clear, so it is anybody's guesswork at the moment.
So the concern has also been that limiting the role of medical schemes would be counterproductive to the NHI because, there are simply insufficient resources to meet the needs of all South Africans. So limiting people from purchasing the medical scheme coverage they seek will seriously curtail the health care that they expect. How valid is that concern?
Yeah, that is our thinking as well, Clement. If you look at what the bill seeks to achieve and what is contained in the bill, we feel that the intention is actually far removed from the actual wording. Now, we do have an experience quite recently where the private funding sector and the private sector at large was able to assist the government in terms of a particular purpose, and I'm referring to the COVID situation. When it came to service provision as well as the vaccination process, the government was able to call upon the private sector to assist not just in the rollout, but also in the funding for the services. This was in recognition of the resources that are quite limited. And for the bill to exclude the funding side in the private sector would actually limit the rollout of these services. We do know that the state is currently looking at probably about 55 million or so people who are not covered by schemes. But there are constant reports of long waiting periods or at times even essential services being curtailed because of budgetary constraints. That's from the financial side. The second aspect is that those who deliver the healthcare services themselves and also the facilities are quite constrained at the moment. And even if you were to add the services that are in the private sector, you will still not be able to cover the 60 plus million people that are in the country because we are all aware of the shortages of healthcare resources and other facilities. So we are of the opinion that this is a moment where all the resources need to be put, and the private sector is definitely an asset that the government actually use in the rollout of services.
Yeah, there are a number of doctors who have said, well, the focus right now should actually be on fixing the public sector to a point where it can begin to appeal to the private sector patients. But when you look at the current quality of health care, you can't help but wonder if really we are ready for NHI. Have hospitals managed to meet the high standards that are required by the National Health Insurance? Because many facilities have been failing the norms and standards. that these health institutions need to comply with before the NHI is implemented?
Yeah. You will remember, Cleven, before the bill was introduced, the government went on what was called the pilot project phase, or the health system strengthening phase. One of those elements they spoke about was the ideal clinic. Their own report, I think in 2018 thereabouts, actually indicated that in fact, let me say the majority of facilities in the public sector would not meet the requirements. But having said that, it is true that when you have a need to revamp the system, you need to have a holistic approach. And just looking at the NHI as a single solution that is going to fix everything would be short-sighted. Fortunately, there are templates that have been established by the WHO, and also to a large extent the United Nations with its Sustainable Development Goals. When we look at healthcare reform, we should make sure that we look at what else needs to be done. It's not a matter of do this one first and the other. We believe that you can actually do most of this in tandem. The recent example of the cholera outbreak in Hammanskraal is a good example of how things work together. You've got poor sanitation and water provision, no energy. As a result, you have an outbreak of a disease that has an impact on the healthcare system.
Yeah. So another crucial aspect, and I'm looking at research here that's been done in the past, that indicated that 260 doctors and specialists are emigrating every year. And I guess the missing aspect when we're having discussions around NHI is the plan to halt the exit of these professionals. Have we thought about that thoroughly?
There is some work that was done, at least in terms of assessment of what is required from the health workforce perspective. And I think there was a report that came from that work around 2018, 2019. The report was quite grim in terms of its findings, in terms of what needs to be done in terms of investment. And these are resources that we do not have. So we cannot really afford to have an exodus of practitioners. When you look at what needs to be done, it can't just be maybe at the tail end to get how to make the environment favorable. You have to actually look at the entire value chain. Are we doing enough at schooling level to make sure that there are enough teachers that would provide a fertile environment for those students who would go into the sciences environment? Do we have enough medical schools or nursing colleges that are available? Are we looking at all the other resources that are required? Now, there has been a lot of suggestions from the private sector. I know that the private hospitals, have extended a hand to government to say, we have facilities and capacity. We can assist with the training. And it goes back to the point that I made earlier, that we actually need all hands on deck. Government does not have the necessary, or all the necessary capacity or facilities to be able to produce what is required. And the issue of the health workforce should actually be priority.
Mm-hmm. So what suggestions would you be making to government? I mean, this still needs to go through the NCOP. What kind of changes would you like to see and clarity that you would like to see made in the current bill?
So there are processes that will be defined by the bill itself, because when it goes to the NCOP, there will be those town hall meetings, and then we'll be able to make formal suggestions. Now, the bill is limited largely to financing or financial mechanisms and restructures to a small extent. So we will participate in that part, but we still encourage other processes. We know that through B4SA, there are discussions that are ongoing with the department. The BHF as well has got ongoing discussions with the department to look at all the other elements. From our side as medical aid schemes, we are also looking at how to revamp our environment to make sure that medical schemes are universal healthcare coverage ready, to make sure that our programs would mirror what government is trying to do. So it is a multi-pronged approach that is required. While we will contribute to the development of the bill and to make sure that it's fit for purpose, there's a lot of other work that we'll be doing on the side to make sure that we cover all the bases.
All right. Dr. Katlego Mothudi, Managing Director of the Board of Healthcare Funders, thank you for making time for us.